Hello, I'm Bill Glover. I'm president of APsaA, and I'm speaking to you from my home in Berkeley, where things are still pretty calm, relatively calm, I should say. You know, we're all in the midst of a global pandemic, and everyone is scrambling to try and adjust their lives and their practices to meet the health crisis. So it's quite a new world we're in. And we're talking about distancing. And social distancing is the name that people are using, but we all know that means physical distancing, not social. We can still be social. It needn't mean clinical distancing either. We can still be with our patients and our students in other contexts and socially as well. Our institutions are also scrambling, and our staffs are really working overtime, especially at APsaA. Our staff's in New York, they're working from home, very hard still. Tom Newman, our executive director, is leading the effort. He and I are in daily contact. I try not to call him before breakfast or after dinner, but I don't always succeed. And I'm sure everyone else is doing similar kinds of things. And this message goes out to the whole psychoanalytic community, not just to APsaA members. We really felt that we needed to do this, try to provide a space for us to come together. And one of the things we're doing is we have a dedicated committee, the COVID assistance team it's called, and it's chaired by David Scharf and Todd Essig, a large staff and a large group of volunteers, I should say, and also staff. And they're putting together a list of resources and which is available at the text that accompanies this message down below, I think. And they, one of the things they're doing, they have a list that goes out that all the APsaA members are subscribed to. And if you're not an APsaA member, you can subscribe to it, and the information will be in the text below this list, below this video. So now we all need technical help, and we're also trying to provide that. The COVID group the team is providing some instructional seminars. They're also going to put together some study groups, peer consulting groups that will be organized. So stay tuned for those kinds of activities. And I know that a lot of other places around the country are doing similar things. So, you know, we're not alone in this, and pick the resources that best meet your needs. In addition to the technical help, I want to say one thing. We hear a lot of talk about best practices, but somebody has pointed out it's really what we need now is good enough practices. Everyone will, you know, find the platform of their choice, develop the, you know, the parameters and techniques with advice from others, and figure this out. But it's quite a transition right now as we go through this really what's really a digital migration that we're experiencing. But in addition to the emotional help, in addition to the technical help, we really need the emotional help we can give each other, and trying to create reflective spaces where we can maintain a psychoanalytic attitude with ourselves and each other and about what we're going through. In psychoanalysis, we also have a social role. And I was listening to the APsaA webinar on the COVID crisis, and Stefano Bolognini, he was speaking to us, past president of the APsaA, was speaking to us from Bologna, which, you know, is one of the worst hit places in the world, and talking to us about his experience. And he mentioned the importance of psychoanalysis social role, which is that helping provide meaning in this time, not just dealing with the crisis, yes, in tactical, strategic, immediate, pragmatic things, but also a space for meaning, and people can grapple with the pain and the suffering that's going on and is coming as it comes nearer to us. We're seeing that happen. And we also, you know, need socially to support each other, since we've lost a lot of the informal contexts as well as the formal ones. And I have to tell you, I don't think I've ever been as glad to be at a psychoanalytic committee meeting as when I see my colleagues come up on the screen in these last few weeks as we've met together. It's we do the work, but it's also just reassuring and heartening to see each other. Also, just wanted to mention that times like this, it brings out the best in us, but sometimes the not so good, that we can get short-tempered or impatient. And so I want to remind us all to be tolerant, patient, and understanding of each other, and we'll get through this. We also need, we realize it's going to be a long haul, and we need to prepare for the duration. So in addition to the rapid responses we're doing, we're also trying to set up some structures and some spaces for the emotional work that it's going to need to be done, that we're starting to do, but it's going to continue. So some of the efforts that I've mentioned will go in that direction. APsaA has also begun town halls. We had one Sunday last, over 300 people attended, and it was brief information at the beginning. Kerry Sulkowitz gave a brief comment about his work with people dealing with the pandemic. And then we had a sharing from the audience, which was really quite moving, and everyone, it was palpable how much people appreciated being together. Getting a little sad as I think about it. I mean, and, how impactful this is, and how we need to have space to be together to process it. So for the long haul, also want you to keep in mind that APsaA's June meetings in Chicago have been canceled, but we're arranging a virtual program instead the weekend of June 19th and 20th. I've talked with Don Moss, the program chair, and they're excited. They're arranging a very interesting group of programs, so stay tuned for that. And we'll be doing other things. So, and they're going to be open to the entire psychoanalytic community. So we'd also invite you to let us know what your needs are, to let me know, and we'll try and respond. Most of all, let's stay connected. We have more in common than anything that divides us, and together we can get through this. Thank you.